My name is Max Wintermark. I work in neuroradiology at Stanford, and I would like to welcome you to the ACR Value-Based PQI project. You can see at the bottom of this slide the web link. This website contains all the information that you need to successfully conduct the PQI project. We have recorded a series of webinars/podcasts to give you an overview and to also explain different aspects of the PQI project. In this first module, I'm going to give you the rationale for the project, how we got to design it and to create and implement it. In module 2, Chris Hobson will tour you through the PQI website. An important component of the PQI project is to interact with your referring physician to improve their referral patterns in terms of imaging studies. And Rina Kiefer will give you an overview of all the interventions and education solutions that are available on the website. And finally, in the last module, Becky Haynes and Dr. McGinty will give you an overview of the Imaging 3.0 initiative of the college, which is the umbrella initiative under which this PQI project falls. The idea was generated when we were brainstorming about the research track of the ACR 2015 annual meeting. We're trying to think of a way to demonstrate the value of research to our members, and we thought that engaging them in a research project would be probably the best way to achieve this goal. That's when we thought about designing it as a PQI project so that our members could claim PQI credits for their maintenance of certification. And we also try to design it in such a way that it's relevant for radiology as a profession. And so we designed around the concept of appropriate image utilization. Here, the idea is that while the goal for individual participants will, of course, be to get their PQI credit for their maintenance of certification, the way the PQI project is designed will also allow ACR to pull the data and demonstrate at the national level the very important role that radiologists play in terms of ensuring that patients get the appropriate imaging. The PQI project is articulated around 10 Choosing Wisely topics. The Choosing Wisely campaign was developed by the American Board of Internal Medicine and focuses on tests that are sometimes ordered inappropriately. And because those imaging studies are part of the Choosing Wisely topics, it's very likely that your referring physician will already be aware that's an area that can be improved, and so it should be easier to engage them. The PQI project is part of the bigger Imaging 3.2 initiative of the college, which is basically meant to prepare us for this transition from volume-based care to value-based care. The PQI project was, as you can see on this slide, designed by a very large group of people. So I want to thank personally each members of all those different groups in terms of the very important role that they play in terms of creating the PQI projects and refining it. We had a number of radiologists, but also a number of ACR staff members as well as the ACR Select team. The PQI project was tested in an alpha phase involving 2 sites, the Lehigh Clinic and Charlotte's Radiology, and those colleagues gave us a huge amount of feedback that allowed us to make the project much better, so thank you for their help. And then we rolled into a beta testing phase where this time almost 15 practices were involved to, again, test the different topics and make sure that everything is working. And the PQI project will be launched at the ACR 2015 meeting. The first thing you need to do is to pick your topic, to pick the initiative for improvement at your practice. You also need to think of an imaging study type where it would be relatively easy to interact with the referring physician when it will come time to educate them and improve their referral pattern. PQI project looks exactly like any PQI project. You collect a baseline sample of data to assess where you are. Then comes this intervention phase, phase 2, where you're going to approach your referring physician. And finally comes phase 3, which is a repeat of phase 1, where you assess the new baseline and hopefully you see an improvement as a result of your intervention. And we have a visual version of those steps that is displayed on this slide. The ACR has put together all the tools that you need to collect your data. We have a solution center with a large number of interventions that you can use when you are approaching your referring physician. We have designed the different tools to grade the appropriateness of studies, that's ACR Select, to extract this data, to prepare the report that you need to have at the end in order to get your PQI credit. We have worked with the ABR to get this project approved. And so everything is available on the website. In conclusion, I want to mention that this PQI project will help ACR demonstrate the value that we as radiologists play in terms of ensuring appropriate imaging in our patients. And so by participating in this project, you not only help yourself for your maintenance of certification, but you help all of us as a profession to show our values. I thank you in advance for your participation, and I hope you have fun when you participate to this PQI project.